President Donald Trump is continuing to pick his cabinet members, and there's a lot of criticism going around, but there's a lot of congratulations going around too. So it seems to be very, very interesting. Folks are thrilled with some of the picks, not so thrilled with others. But again, folks, I mean, we're just learning who he's selecting, and we're going to learn more about these individuals. Like yesterday, he did say that he wanted Dr. Jay Bachara to lead the NIH. Now, that's interesting in itself, given the fact that this doctor is someone who is heavily criticized right now by the media for his stance related to the COVID lockdowns and natural immunity. Now, I think that's a good sign when you look at all these article headlines and you see that they're all going against him because they don't like what he said during the pandemic. But don't take my word on it. He was a critic to Dr. Anthony Fauci years ago as well. And so that has me a little optimistic. But take a listen to what he said on Fox about Fauci.
If you look at what he's actually done during the pandemic, Laura, he's lied to the American public over and over and over again. First first masks don't work, but no, yeah, I was lying to you. I just wanted to spare the masks. Then he said 60% for herd immunity, 70% for herd immunity. Then, oh no, I was lying to you because you couldn't handle the number. And then he said, if you get vaccinated, you can't get the disease, you can't pass it on. Over and over again, he has basically tried to dissemble in order to manipulate the behavior of American people. How is he going to look in the face of students and say, you have to tell people the truth in public health?
That's what the American people want. They want the truth when it comes to our health. It's one of our goals, especially on this show. We try to dig deeper into these topics. Joining me now to discuss is Dr. Peter McCullough. He's an author, physician, and a scientist, and he's with us now. Dr. McCullough, I want to thank you for joining me because we've been learning about all of these picks right now, and there's a lot that Americans are kind of just questioning, and they're not really sure what they can expect from the latest picks that Trump has made. So Americans who are on the fence right now, what can they expect? Because, we still have confirmation hearings underway. They're going to be taking place soon, I guess I should say. So what do you think we have down the line?
I think Americans will just look at who is in these positions for HHS secretary, which is the biggest one, over a dozen reporting sub-agencies. We had Alex Azar under Obama and Trump in the first administration. He's the former CEO of the U.S. division of Eli Lilly. So he's a drug company, president who led HHS. And then after him, Xavier Becerra, who is a career politician, both of them honestly not aligned with the health of America. Now Robert F. Kennedy comes in with a broad, sweeping mantra of make America healthy again. But Kennedy is going to face huge resistance from big food and big pharma. These lobby groups are very, very powerful. They don't want to see any change occur with respect to their product and their product lines. And RFK is really pledged to make America healthy again. That makes making more healthy both biopharmaceuticals and food products.
Yeah, well, that's why I'm so interested in the RFK aspect of all of this, because the people who have been, I think, are intentionally making this country unhealthy, so we become long-term customers to big pharmaceutical companies, are against him, and I think that's what's so critical here because we're trying to save America. If you look at our country, the chemicals they pump into our foods, what we have to, I mean, so many. Another one of my family members was just now has diabetes type 2, and that's unheard of in my family, but for some reason, and it's crazy because they're not overweight physically. So this means that it's the chemicals that are being pumped into their food, and so many Americans are dealing with this now. Um, what's the uphill battle that Kennedy's going to have when he's trying to fight these pharmaceutical companies? Because they're a bip machine.
Mm-hmm. Well,
Yeah.
I
So what do
can
you
tell
think
you,
he's doing?
he's going to have advocacy on food. For instance, America Heart, has a resolution since 2009 to get trans fats out of the food supply. McDonald's did this, and the other fast food companies in 2006 in New York City under Bloomberg. Heart attack rates dropped. WHO launched an initiative called the Exclude Initiative in 2018 to get trans fats out of the food supply. AHA has been working with WHO and the FDA, which has been slow walking this. Now, fast foods are largely free of trans fats. We're talking about partially hydrogenated soybean, other oil, and other seed oils and vegetable oils. But I can tell you the group that hasn't is all the packaged food that you see, on the counter from crackers to cookies, granola bars, um, uh, microwave popcorn, frozen pizza. They are loaded with trans fats that directly stimulate production of cholesterol, directly atherogenic, make people obese. And so he's going to have a lot of advocacy if Kennedy can show leadership skills and bring all these stakeholders in and drive this over the finish line. Now, he's going to get opposition from all the companies that make these products that don't want to do product reformulation and make healthier products. On the biopharmaceutical side, what Kennedy has said is, listen, he's not going to take away people's vaccines or other biopharmaceuticals, but he's demanding safer products, and the companies show us that they're safe.
Dr. Peter McCullough, I mean, I'm making better choices. I'm avoiding foods that do contain seed oils,
Mhm.
even the processed foods these days. And there are options. I just think a lot of Americans don't actually know the difference between seed oils. I mean, like the potato chips I use, I mean, it's avocado oil, which they say is a little bit healthier for you. But when it comes to educating Americans on making healthier choices, especially when it comes to processed foods, what do you recommend?
A great place to start is the American College of Lifestyle Medicine. I just interviewed their founder and former president, John Kelly. But I agree with you. You have to look at the package. One of the things to avoid is what's called partially hydrogenated anything. That's really that means they're basically super saturating these forms of fats. Most commonly, it's soybean oil, by the way. And so that's what makes something last on the shelf for 10 years. Army rations are loaded with them. So yeah, you don't want to buy things in a package or a box. The other thing that's been pointed out is the food dyes, the bright yellow, orange, and red food dyes that are in various forms of Fruit Loops and other cereals. They potentially are neurotoxic. So as people eat more raw, fresh food, getting away from these packaged food, that's a good step. What people will say is that, listen, they have that the public has to make healthy choices. They're not, quote, being poisoned by the food industry. They're making choices. And like you said, it's up to each one of us to do our own navigation.
Yeah, the problem also is it's a little bit more pricier when you make that little healthier
Mhm.
choice. I mean, I'm noticing a bag of chips for me is like $5 these days when I am going with the one with the avocado oil instead. So there is that one factor that I think a lot of Americans just can't tolerate right now because of all the financial burdens involved with this. But a lot of us look over at the EU and we're told that the way that they've been handling the food issues, banning certain chemicals from being used in food products should be the way that we go about it here in the United States. Do you agree with that?
I agree. European Commission, and I know it well because I testified in the European Parliament last year. The European
Yes.
Commission is the executor of what happens in Europe. They just make decisions that make sense, and they get things out of the food supply, glycosate, trans fats, these harmful food dyes, and they appear to be better off for it. So hopefully Kennedy again can bring the stakeholders in, frame the issues, drive consensus, and then do public policy. That's the correct way to do it. He's going to have to change from being a content expert, he knows a lot, to being a leadership expert. And that's something very different.
I look forward to that, though. It's going to be interesting to see how this all pans out, especially for all of President Trump's picks, because the Senate, I mean, even though Republicans have the majority, they're still planning on pushing back on a lot of these picks because they, aren't very happy with some of them. And that's also in the defense, side of all of this, not just the health side of
Mhm.
it. So we'll see how it all pans out. Dr. Peter McCullough, I want to thank you for joining me today. I also want to remind our audience you do a great job over at Substack. We've got the link for your Substack in the description of this video. So make sure you give him a look over there as well. Sign up for his list and also give him a follow on X. Dr. Peter McCullough, as always, thank you.